No warning, no clear signs, and a stroke can strike. It happened to an Austin woman whose only treatment is a stent that is not on the market currently. As KXAN's Gigi Barnett explains, doctors say her stroke started in a place where doctors don't normally look.
Knock. How are you?
41-year-old Heatherly McDaniel knew something was off the day she had a stroke last year. Her then 16-year-old daughter recognized the slurred speech and numbness on one side.
She looked at the situation and she said, "This is out of character for our mother. So what are these signs?" The only thing she could think of is it has to be a stroke.
Her family rushed her to the hospital, where ER doctors treated the stroke caused by a blood clot. But less than 2 weeks later, her left leg suddenly started to swell. It was another massive clot, nowhere near her brain or heart. Heatherly was young, healthy, and had no recent surgeries, not the mold of a person prone to blood clots.
And the problem that Heatherly had was right here.
A rare syndrome was causing one of the major veins in her left leg, the iliac vein, to be cut off, blocking Heatherly's blood flow.
And her vein is like having one lane closed on Interstate 35. When we put a stent in, we open it up to 2 lanes. Traffic should move as fast and normal as it should.
But here's the catch. The new stent Dr. Apple used isn't available yet. Heatherly was part of a clinical trial, and Dr. Apple says surgeons are still using stents created 20 years ago, not designed for the larger leg veins. What's more, these types of clots strike young women, including her sister, Elena.
The typical phone call we get is an 22-year-old female who was recently started on birth control pills about 6 weeks ago or so is a typical case, and they get a huge left-sided blood clot.
So far, only a small side effect.
My leg tingles, my toes tingle, and most of the time I can deal with it because that's pretty minor compared to a few people that I've met who've had strokes.
I'm Gigi Barnett, KXAN News.
Doctors say the next step now is to monitor patients for the next year to determine if the stent is safe for other patients. If McDaniel had not qualified for the trial, doctors would have treated her condition with lifelong blood thinners and compression sleeves. Well, for years, the FAST test has helped people recognize stroke signs. The acronym has been updated now. The last part's the same. F is for facial drooping, A, arm weakness, S, slurred speech, T, time to call 911. But many health professionals now refer to it as B fast. B for balance. If someone can't stand without swaying or falling, there's a problem. E for eyes. Blurriness or one eye seeing differently than the other is also a sign.